Okay, so let us look at the nutritional requirements for a sick person. What we are basically looking at is a person who is basically sick, whatever disease that they could be suffering from. How do we make sure that they get the nutritional requirements that they actually need in order to recover from the illness? And to do that, we need to look at this scenario. We are having Sarah, who is a 17-year-old girl. She has been sick with typhoid and now she is discharged. However, the discharge advice is that the mother needs to make sure that Sarah actually receives enough nutrients that will boost her immunity and enable her to basically recover. So, what are those dietary recommendations that you can actually give to Sarah during this recovery period? And can you give any reason for each recommendation that you are actually giving? When we talk about therapeutic nutrition, what do we actually mean? And why is it very important for people who are recovering from illnesses? And what are the consequences of poor nutrition on people who are actually sick? And then lastly, can you create a meal plan? Okay, a 1 day meal plan for Sarah. Okay, so what this case basically hints on one, that when someone is recovering from illness, they need to be taken care of because their body has been drained. Okay, so therefore their immunity needs to be boosted. Okay, so that boosting of their immunity can be done through proper nutrition. So what nutrients actually help? What nutrients should these people who are recovering, what nutrients should they actually be taking? Those are questions that we can actually be able to address in this session. So food actually determines whether you are going to be healthy or not. So if you eat poorly, you are likely going to have health risks. Okay, so that means that eating well is part of making sure that you are healthy. But again, also, food can be utilized to make sure that uh, your health is actually restored. So when we talk about therapeutic nutrition, we are talking about using diet or food to aid your recovery from one illness. So the foods that are given to a sick person to help in their treatment and management of the disease that they are suffering, that is what we term as a therapeutic nutrition. We actually have what we also term as therapeutic diets. These are specialized diets for people who have particular conditions. Okay, so that means that if a person is actually sick, it's very important that we modify their diet according to what their body actually needs. That is quite important, especially given that the illnesses that they actually could be having, these illnesses often cause destruction of body function. Okay, or alteration of body function. Tissues could be worn out and tissues could be dying. So that means that all the things need to be restored. People are given therapeutic foods because the foods help in boosting their immunity. That's one. Some of the illnesses, for example, diarrhea, it results into people losing important nutrients like even ions, all these, whether it is amino acids, whether it is glucose, whether it is what. These things are lost in particular conditions. Vomiting brings problems. diarrhea brings problems. We have also illnesses that make it difficult to absorb nutrients. So that's why this therapeutic nutrition is actually very important. So we need people to continue eating when they are sick, such that they can replace the lost nutrients, but also these nutrients help in repairing worn out tissues, or even repairing different body structures. This nutrition also helps in boosting their immunity so that they can fight off the condition. Sometimes people cannot actually eat, they lack appetite. So we give them foods that would improve their appetite. Okay, so the therapeutics foods or therapeutic foods or diets can be given to people who have short-term illnesses, or to people who are having long-term illnesses. For example, if you have a person who has had, let us say, typhoid, like for the case of Sarah here, even if it is a short-term illness, they still need to be taken care of in terms of nutrition. But if you have a person who has had, for example, diabetes for a long period of time, or hypertension for a long period of time, it's still very important that they are given therapeutic foods. Okay, so generally, what happens when a person is actually sick? Okay, what happens as far as nutrition is concerned? One is that the body will actually demand a lot. There will be an increase in the body's demand for energy. So that means that the person actually needs to eat more nutritious foods. The second thing is that if the illness involves a tissue repair, or if the illness involves destruction of tissues, then it means they need more proteins. So, for example, if someone has had a burn, okay, person has got burns, or if a person has got an injury, the person needs to recover by taking insufficient proteins, because it is these proteins that are very important in tissue repair. But also, a person with burns will lose water, that is dehydration, will also lose a lot of minerals. So they will need these minerals. They will also need these what? This water. But also, they need to boost their immunity such that they can fight off infections that can come. So that is why it's very important for every individual who is ill, who is basically recovering from illness. They need to have all these nutrients, whether it is calories, whether it is vitamins, whether it is proteins, and many other things, water, minerals, and things like that. Okay, these are all important because it is time for the body to carry out a number of metabolic processes that require energy. That's why energy requirement happens, increases. Um, Time for repair of tissues, proteins have to be increased. Boosting immunity, vitamins have to be supplied. Um, Improving hydration, person needs to be given a lot of fluids and all the things. So all the things are all very important for all those reasons. So if you have a person who, for example, has a specific condition like diabetes, what is very important is making sure that they have their blood glucose levels in check. Okay, that's very important. So usually it is recommended that they have low sugar foods that contain little sugar. Okay, little sugar. So limit sugar intake, limit refined carbohydrates, and limit saturated fats. But encourage more whole grains. Encourage high fiber foods, lean proteins, and vegetables. Those are very important. Don't allow them to eat large amounts of food at the same time. Give them the small foods at regular intervals. This will help in making sure that level of glucose does not spike up. For individuals um, who are living with HIV stroke AIDS, these individuals need optimal nutritional care. So what's very important is that they need to have high calorie diet, high protein diet to make sure that they compensate for the weight loss and muscle wasting that can happen. Boost their immunity. Vegetables are very important. Fruits very important, and antioxidant-rich fruits are also very important. These help in boosting their immunity. These are basically vitamins that we are talking about here. Of course, make sure that they eat safe food, such that you don't have cases of diarrheal conditions or infections. Okay, and then lastly, they need to be well hydrated, but also they need to stick to their medication, but also can take some supplements if they are desired. Okay, so for individuals who are having gastrointestinal infections, what do you actually do? A person who has gastrointestinal infections, they are likely to have diarrhea, vomiting, and because of these two things, um, they are likely to be dehydrated, lose a lot of ions, and also not have appetite. So these are problems that you could likely expect in such a person. Typhoid, like in our scenario here, is an infection that affects the gastrointestinal tract. Okay, so what do they need to do? Make sure that they take sufficient water to replace the water that is being lost. Of course, usually if they're having diarrhea, ORS could actually help. Okay, but they can basically take the usual fluids. Okay, you can avoid dairy products, have high fat, also avoid high fat foods, avoid caffeine until recovery. You can introduce other foods when they can tolerate. Like I said, some of the foods they can actually vomit or cause them diarrhea. So give them foods that are easily digestible. So rice, banana, toast, these can actually help. Okay. So for a sick person, just make sure that you have a good meal plan. Usually, this meal has to take into consideration their age, the illness that they are having, their weight, and medications that they are actually taking, and also their preference. Okay, so you need to make sure that you choose the foods that will provide them with the calories that you need, the proteins that you also need, and also the vitamins, minerals, fiber, and also water. Okay, you can use certain tools like the food pyramid, the one we have just looked at, to determine these foods fall under which categories. If you're going to have um, you're making a breakfast for a patient who has diabetes, you need to make sure that you include some foods that we have put on the screen that can help in making sure that they don't have a spike in glucose levels. Okay, so in summary, if the person is having an infection or fever, that means that they need more fluids, they need more energy or calories, or basically carbohydrates, they need more vitamins, especially vitamin C, and also proteins for repair. A person with diabetes, we have just said low sugar, high fiber, and avoid simple carbohydrates because those ones spike very fast. And then the diarrhea and vomiting, the problem there is dehydration and loss of minerals. So make sure that the person drinks sufficient fluids and give them ORS such that you replace the ions that they are losing. Give them digestible foods, carbohydrates, and for example, the bananas that you can give. A patient who is having HIV stroke AIDS, high protein, high carbohydrates, and also the vitamins are very important to boost their immunity. Make sure they eat safe foods. A person who has had an injury, whether it is a wound, whether it is surgery, they need proteins and vitamin. Ions are also important for replacing the blood and also zinc. So in this case, what could you recommend for Sarah? Definitely typhoid, you need proteins to help in the healing process. Uh, Typhoid is associated with vomiting and diarrhea. You need hydration. And then typhoid is also associated with loss of energy. So you need to give them carbohydrates, okay, calories. Okay, therapeutic nutrition, you already know. This is very important for their healing process, for Sarah's healing process. And consequences of poor nutrition, in sick people, the person takes long to recover, and then because of the healing process not basically happening, they are also likely to get other diseases on top of the disease that they have. So you don't want that to happen. And for the case of the meal plan, breakfast, lunch, and supper, and meals in between, you can look at that. You can choose what to give them at which time. What's very important is that they have the appropriate nutrient combinations that you want them. If you want proteins, when they're giving them, they have these proteins. If you want carbohydrates, also the vitamins and the other requirements, what do you do? So you can think about the meal plan.